Hi, it's Dr. Gregory Morris here today for another episode of Talking Feet for the Ultimate Foot Store. Today I'm going to talk about diabetic foot care, and it's a big part of my job is taking care of patients with diabetes. And people don't realize how much it affects different parts of our body, diabetes, and it's a huge amount of the population has diabetes, especially here in Hawaii. So diabetes, first of all, can affect circulation to our feet. So what happens is the circulation to our foot gets clogged up over time. Just naturally, our arteries clog up in our heart and especially in our legs, just naturally. And if you have diabetes, especially if not controlled well, the arteries to the foot and the leg can clog up, causing poor circulation. So you often see people with like dark or discolored legs. Oftentimes it's caused by diabetes or poor circulation to the foot. Because of that poor circulation to the foot, well, then people don't heal very well. So if you get a cut or a sore on the foot, it'll take a long time to heal and have an increased chance of infection and other complications. The second thing we worry about with diabetes is developing diabetic peripheral neuropathy. So what happens is the nerves to our feet are often affected from diabetes. Once again, if not well controlled, the nerves to our feet can die over time. And it happens when you develop diabetic neuropathy, oftentimes people have numbness or tingling, especially at the tips of the toes, starting at the tips of the toes, and slowly works back to the middle of the foot. And over time, you can have numbness, you can have tingling, you can have burning, all kinds of different sensations to the feet. People often tell me their feet feel wet or cold, or even like there's something stuck to their foot when there's nothing down there. And the problem is if you have diabetic peripheral neuropathy, is that you might get a cut or a sore once again, or a blister, and not realize it. And if that combined with poor circulation, combined with uncontrolled sugars, is a very bad scenario for developing bad infections, which will often lead to amputations. As part of my job is I do a lot of wound care and I do a lot of amputations. And that's why I like to do a lot of diabetic foot care to prevent this from happening. So the first step is just basically check your feet every day. And so taking a look every night after you take a bath or a shower, checking and seeing if you have any kind of blisters or cuts or sores. If you have difficulty checking the bottom of your foot, using a mirror to check the bottom of the foot or having some family member check your foot, every day is a good idea. If you do notice a cut or a sore or a blister, well, if it's very small, keep an eye on it. Maybe if it's open wound, keep it clean. Use some topical antibiotic like Neosporin or bacitracin and a Band-Aid. If that wound is bigger or doesn't look good, well, then you come and see me or the urgent care or your primary doctor right away. The sooner you treat it, the less chance of developing complications such as infections or amputations. So checking the feet every night is very important. The second thing is wearing good shoes and sandals to protect your feet. Especially here in Hawaii, we're not going to wear shoes all the time. So if you're not wearing shoes, make sure you wear a good pair of slippers or sandals. Even in the house, you worry about stepping on things. You can have a broken piece of glass in the house. We're also kicking things in the house too. So wearing good shoes, sandals, slippers, that give you lots of protection to your feet. When you buy shoes, make sure they're nice and roomy. Nice wide toe box, especially here in Hawaii, we have wider feet. And a lot of shoes are very tight and they can cause blisters or sores to the feet. Another good idea is buying shoes in the afternoon. During the day, our feet swell. So if you buy a pair of shoes in the morning, the shoe will be tighter throughout the day. So best to buy a pair of shoes in the afternoon. Wearing good socks. So socks are very important. They take down the friction. Once again, if you can't feel your feet, then the foot can rub and develop blisters. So wearing shoes and socks is ideal if you have diabetes. Once again, in Hawaii, we don't wear shoes all the time. So wearing a good pair of slippers or sandals that give you good cushioning, good support, don't rub funny, very important. Also, when you buy a new pair of shoes or sandals, make sure you break them in. So the first couple of days you have a new pair of shoes or sandals. Check your feet every night. Make sure you're not getting any rubbing spots. Making sure there's not any spots where turn red or you're getting little blisters or sores. The next thing I do with diabetic patients, so at first I check the circulation. The second thing I do is check for diabetic neuropathy. And we check for the diabetic neuropathy, oftentimes using a small little piece of fishing string, like a little monofilament wire. We test the bottom of the foot with the patient's eyes closed to test the toes to see if they have any kind of sensation. This very light touch is very good. If they can feel that, then they still have really good sensation to their foot. If they can't feel the night, we call monofilament testing to the bottom of the foot, then we're more concerned, and usually you see those patients more frequently. So we like to see diabetic patients usually once a year for diabetic foot care, but they have certain criteria such as poor circulation or decreased sensation to the foot, then we'll see them more frequently. Oftentimes, patients with diabetes also develop different problems like bad toenails, ingrown toenails, thick fungus toenails, which are very difficult to cut. And so if patients have difficulty cutting their toenails, they have ingrown toenails or are at risk for infection, oftentimes they see a podiatrist every 2 or 3 months to have their toenails cut and to have corns and calluses cut, but most importantly, to check their feet to make sure they're not developing diabetic neuropathy or peripheral vascular disease, which may lead to amputation. The last thing I do when I check a diabetic patient is check for different deformities on their feet. So you have hammer toes, which are basically the toes no longer straight. They've become contracted over time. That's a danger because when people have like hammer toes, their toes are curled up. Well, the toes can develop sores on the top of the toes. When they wear shoes, they can develop sores on the tips of the toes or on the ball of the foot. So it's very dangerous. So that's something we look for is, hammer toes or even bunion deformities where the bone sticks out on the side of the foot. Different areas on the foot which are rubbing funny. And so there are spots we watch out for, and then we make accommodations with their shoes and padding to adjust for those deformities. And so that's the biggest things. So the diabetes. So I always tell my diabetic patients, yeah, I'd like to see you once a year to check your feet, check for your circulation and feeling, check for deformities, check for ingrown toenails. But if you have risk factors such as poor circulation or diabetic neuropathy, or have had a history of ulcerations or infections to the feet, we'll see more frequently. If they have problems such as deformities that are causing bad hammer toes leading to pre-ulcerative or corns or bad toenails, then we'll have them come more frequently and cut the toenails or calluses. And then most importantly, checking their shoes, make sure they're wearing proper shoe wear, shoes that are not rubbing their feet, wearing socks that do not to protect their foot across there too. Once again, this is Dr. Gregory Morris for Talking Foot for the Ultimate Foot Store. Stay tuned for our next episode of often underlooked important things of socks for our feet.